Hi everyone, my name is Hannah Hediger and today I'm going to be doing my newborn assessment. I'm going to be assessing Benson. He's 6 months old. So the first thing I'm going to do is I'm just going to look for general observations. I'm going to check posture, so his arms and legs, his won't be like this, but for a newborn, hands will be fisted and arms and legs will be flexed and they resist extension. For color, where are you going? For color, the baby should be pink. If they have a little discolored hands and feet, that's generally normal. If the baby is over pink or almost red looking, that may indicate prematurity or polycythemia. If the baby is too pale, that could indicate infection, respiratory problems, cardiovascular problems. To take a pulse on a newborn, come back. You're going to want to take the apical pulse for 1 minute. So you're going to take that for 1 minute. Then you can move on to respirations. You're just going to put the hand on the baby's chest and you're going to count the respirations for a full minute. And then to take the temperature, you're going to want to either go in armpit or you can go temporally. Come back. Say hi. So if a newborn has apnea over 20 seconds, that can generally mean that there's cardiovascular and respiratory problems, sepsis, and too hot or too cold environment can greatly influence a newborn's temperature. So next, moving on to the head, for the nose, you're going to want to observe patency of the NURS and the shape of the nose. The nose should be midline and minimal discharge, and you definitely want to assess that the NURS are patent. The ears, so you want to assess the placement and you want to assess the cartilage. The corners of the corners of the eyes should align with like the top of the ears, so you can't see him. Like right here. And then for the mouth, you want to make sure it's pink and moist, and you're going to assess the sucking reflex on a newborn. Hello. And you want to check the lips as well. And then next, moving on to the neck, you want to make sure there's a good range of motion. You want to make sure there's no damage to the neck. So the neck should be mobile, no bruising or anything like that. For the chest, you want to assess the shape and symmetry, and you're going to want to listen to lung sounds. The lung sound should be equal, and there may be some crackles. And you also want to make sure you're checking the clavicle to make sure there was no damage at birth. And then variations besides barrel chest are abnormal and should be looked into more. As I mentioned earlier, broken clavicle may be due to birth. Next, you're going to inspect the abdomen. You're going to want to make sure the abdomen is not distended. You're going to want to palpate the stomach. Here. Palpate the stomach and then listen to the bowel sounds. Okay. And for a newborn, you're also going to want to check the umbilical cord. It should be a grayish color, not a lot of redness, no discharge. If there is drainage and redness, this may indicate an infection. And if the baby's abdomen is distended and very hard, you'd want to let the provider know. For musculoskeletal, you want to expect the spine and extremities and the gluteal folds. The arms and legs, they all should be symmetrical. You want to count all the fingers and toes. The spine should curl in a C shape. The doctor will also perform the Orlani test to make sure there's no hip dysplasia. Let's see. And for the genitalia, you want to assess the placement of the urinary meatus, palpate the scrotum, and the urinary meatus should be at the tip of the penis. Scrotum should be large and rugated, and the testes should be palpable. And that concludes my assessment today. Thank you.